And welcome to the show, everybody. My name is Kevin McDonald, and Rochelle is right here, and you get to view a brand new opening that we are doing now. It's a world premiere, and I'm really excited about it, but we've got a very important author, doctor, and he's a great guest. Rochelle, who do we have on track for today?
Today, we have the honor of welcoming Michael Godin into our world so everyone can meet him. Follow along with us, everybody, at his website, msgodin.com. This man is a surgeon, a best-selling author, an enthusiast, and so much more. So stay with us so that we can meet him and learn more.
And his latest book, he talks about a middle-aged man who is divorced, and now he's in the dating scene. And I got to tell you, and it's a funny book, and it's real to life as well. And we'll be right back right after this. There's a moment in every life when you decide to rise.
To stand taller than your fear.
To speak louder than your doubt.
To chase the vision that sets your soul on fire.
This is that moment. And here we walk it together with stories that awaken, voices that inspire,
and truths that set you free.
This is Positive Talk Radio with Kevin
and with Rochelle,
where hope has a voice.
And that voice is yours.
And welcome to the show, everybody. I hope you like that new opening. I've spent, minutes working on it. So, in any event, Rochelle, we've got a great guest here today. And would you like to have the opportunity to introduce Dr. Michael Godin?
Yes. Godin. Well, thank you so much,
Godin.
Michael Godin. Dr. Michael Godin, for being here. How are you doing today, sir?
I am well. Thank you for that kind introduction. I'm happy to be here. Happy to be back, as a matter of fact.
As a matter of fact. And by the way, it's a pleasure for us to be talking with you again. And you've got a brand new book out that is just hot. It's called Fighting Gravity. And we're going to talk about that. And we're also going to talk about his first book, which is called The Big Prick. No, it's not what you think. Surgery, surfing, and survival in the 80s, San Diego. So welcome, Dr. Michael. It's great to have you here.
It's great to be here, Kevin. Thank you. And hi, Rochelle. Nice to meet you.
Yes, I'm very excited to get to know you a little bit more. I know that you have come before in our world, but so much happens in life, so there's a lot to catch up on, right?
Absolutely.
And we're going to talk to you about all kinds of things, not the least of which is you are a plastic surgeon, and you help people live a better life according to the face that they would like to have. Am I close in that?
That's a pretty good description of what I do. I do facial plastic surgery, so kind of collarbones north. And I do a lot of cosmetic surgery. I also do some reconstructive surgery as well. Great career. Very, very satisfying. Yeah. Love to help people in that way.
Well, and you will have your practice is actually coast to coast. So you practice in San Diego and also Richmond, Virginia. Is that right?
That's correct. The lion's share of my practice is in Richmond, Virginia, where I've been practicing, privately for 28 years now. So it's been a good run. I see patients in La Jolla, California, and I'm getting ready to see patients in Beverly Hills, California, at the office of my dear friend, Dr. Jason Hamilton. He's opening a brand new office in the middle of Beverly Hills, and we're going to do some surgery and see some patients there as well.
And by the way, if you're in Beverly Hills, you're going to have a lot of patients.
A lot of patients and a lot of doctors. There's it is a very rich area in what I do.
So, Michael, I must ask, what got you into that field of a career and the reason you enjoy it so much?
Well, I think when you're in medicine, you have to decide what you're going to do. And somewhere along the way, I think the first is, am I going to be a surgeon or am I going to be a medical doctor? Do I want to cut? Do I want to use my hands to actually fix people, or would I prefer to just diagnose and do it in that way? And, I knew early on I wanted to be a surgeon. And then once you know you want to be a surgeon, then, what type of surgeon do I want to be? Do I want to be a brain surgeon? I'm no brain surgeon, so I got to figure that out. So what could we do? And the head and neck attracted me very much in terms of the anatomy, the complexity of it. And then within head and neck surgery, there are a lot of different ways to go. And I chose facial plastic and reconstructive surgery to kind of work with the structure and the appearance, and because it has an artistic side. And I guess that is also why I write novels. Creating is a big part of what I hope to do.
Yeah, I love that.
And you've got a couple of novels out, including the latest one, which is Fighting Gravity. I love the premise of the book. Tell us about it.
Fighting Gravity. So this is, I'll put that one right up there. There's Fighting Gravity. You can probably see that it's set in New Orleans. You see Bourbon Street there. So Fighting Gravity takes our protagonist from the first novel about 15 years into the future. He's got a successful practice. He's facing some personal challenges. His marriage has just ended. He has to enter the world of modern dating on top of keeping his practice together and just kind of staying sane. And I think there's a lot of comedy in it. I think there's a little bit of drama in it. There's a lot of medical detail. I describe some surgeries from the surgeon's perspective. I think I take us in a pretty detailed way through a face and neck lift and what's involved with that consultation with the surgery and taking care of them afterwards. So kind of create a mix of the medical, the humorous, and also sort of romantic drama.
Very neat.
So a middle-aged man, which your character is at this point, can they have a romantic drama?
In the fictional world, they certainly can. He does. He has a lot of missteps, and it was a lot of fun, sort of imagining ways in which he could, try to get that going, and some of the things that he might fall into that weren't so good. So, you write what you know, but you also, when you're writing fiction, you have to create, arcs and drama and hyperbole. So, none of it true life. It's all sort of augmented to make a good story.
Well, and speaking of which, we got a middle-aged man with us today. And Rochelle?
Hey, Dad. Gowdy71 says, hello, everyone. Enjoying this episode. I hope you stay and listen. And Doctor, I'm so curious, where was the spark created for the book?
Well, I've always liked to write, and I was both a biology and an English major in college, so I got 2 degrees, and wasn't sure whether I'd do medicine or law. Chose medicine, but I've written many scientific articles, some textbooks, so I've been writing for a long time. But I always wanted to write fiction, wanted to write novels, so I began about 15 years ago, and actually wrote Fighting Gravity first, and had several drafts of it first. Really kind of put my heart and soul into it. And so then I decided, I'm going to write a prequel to that and put that out there, kind of learn about the book business a little bit. So that's where the big crypt came from. And wrote that one shorter book, I think well received. It did well. And I learned a lot from it. And that helped me with the launch of the new book.
Yeah. Can you tell us a little bit about the sequel, then why you chose to do it that way?
Yeah, I guess I started about 15 years ago. I had just gone through a divorce myself. So, it's if you've ever been through that, it's no fun at all. It's a pretty emotional thing, and people, people, get through it different ways. For me, the ability to write about it and kind of, it was cathartic to me. And so I did that, and, it really several different iterations before we came to this book, which I think is much lighter maybe than it started out. I heard an author in a writer's conference once talk about writing from the scar, not the wound. And I think that's kind of a cool way to think about it, so, after you've had time to reflect and things have calmed down a little bit. And I think I've got a good story here. People seem to be enjoying it, and it's been to put it out there.
Congratulations.
You got a bunch of really cool reviews on it. So go to his website again, Rochelle, which is?
Yes, visit his website, everybody, and follow along with us at msgodin.com. The last name is Godin.com. And I just love that. He's got God in his name. I wish I had that.
Well, and I got to tell you. So not only did you write about being middle aged and in the dating scene, you are that. You were that. So it's almost like a bit of a biography because you had to learn all about that kind of stuff, didn't you?
Well, let's be very clear here, Kevin. I was in that. I'm not now because I'm married almost 7 years now. Okay, so my wife would be
Congratulations.
very unhappy if I were in the dating scene currently. I am not. Okay, but yes, I did enter that scene, and it was an interesting experience for me, and but very happy time around, and I think that we'll see. There will be a third book, and we'll see. Maybe we'll take him full circle. Maybe we won't. I haven't decided yet, but starting to rough out some scenes for it already, and that's going to be fun.
I would love for you to name the book The Samsonite Experiment.
Okay, why?
Because it's baggage. Everybody's got baggage by the time you get to middle age. And Samsonite just came to mind as a bag that people travel with and stuff. But everybody has baggage, and they've got kids and they got grandkids and all that. It can be a minefield to negotiate, can't it?
I guess so. I'll take that title under advisement, Kevin. I'm not going to commit to
made it up.
Yeah.
There is a lot of baggage involved because everybody has life and everybody goes through their life, and almost everybody, as a matter of fact, when you re-entered the dating scene, I'm willing to bet everybody that you talked to was either widowed or divorced.
Well, I guess there was a little bit of that, but there was also some people who had never found the right person. There was a good mix of people that I actually talked to during that time, and it was great. It got out and met a lot of interest, and it led me to where I am now. So it was good going through it, but it's good to be through it too.
That's really cool, Rochelle.
I'm just thinking, Michael, how cool that it is that you chose to go into a career of, we hear plastic surgery and we think of these negatives of way of trying to change us to be more fulfilled or whatever it is. But you mentioned doing work for people as well that is healing. I was looking at your website, and you talk about it being through a form of empowerment. Can you talk about that a little bit?
Yeah, I think that you make a good point there. People come in wanting to look better, wanting to see what they see in the mirror more. And it may be that they've just aged. It may be that they've just been through something and they need a lift. It could be a variety of things. Also, it could be that they've had trauma. It could be that they have have had a cancer that they've had removed that they want me to reconstruct. But in each case where the person brings whatever it is through the door, and then we just try to make it better. We try to make it fit them. It's always got to be kind of done in a natural way. And I think if you do that, and their expectations are right, you can have a very satisfied patient and be very satisfying for you. But of course, there are outliers, and you have to be a little careful in my business to be able to screen through patients who are not appropriate, for surgery, who have unrealistic expectations, just want too much. And it's interesting because I see a little bit different population on the West Coast in LA than I do on the East Coast in Virginia. But at the end of the day, I think most people want to look better, but they want to look natural.
Yeah. Well, and I know we need to take a break coming up soon, Kevin, but we talk so much about what it is like to treat everybody as who they are. And I'm guessing that when they walk through the door to work with Dr. Michael, they feel like they're seen, they feel like they're heard, and they feel like they're understood as a person. They matter to him. And so that's why they probably choose to get that work done, because I'm telling you something, doctor. If I was going to have somebody reconstruct my face, I would want to trust them. What do you think, Kevin, right?
Oh, absolutely. And by the way, if you're just listening to this, Dr. Michael Godin has got a great head of hair. And I'm wondering if he does like hair stuff. I'll ask him about that when we come back, because I could actually, I don't know, use some. So Brichelle and I'll be right back with Brichelle, his website again is?
Yes, Dr. Michael Godin. Stay with us, everybody, and visit his website while we're on our quick break at msgodin.com, and we'll be right back.
Can you guess what I'm going to play, Brichelle? Because he said it.
I think so.
Okay, we'll be right back. Here's another point to ponder by Positive Talk Radio. Our scars are not signs of weakness. They are maps. Proof of the battles we faced and the roads we survived. Each scar tells a story. Each mark whispers of resilience. Don't hide them. Wear them as a reminder that you are still here, still breathing, still becoming. You are listening to Positive Talk Radio, where stories of hope live. And welcome back to Positive Talk. My name is Kevin, and Brichelle is right there. And Brichelle, reintroduce our guest for the hour, because he's got a couple of books out, including one that's titled The Big Prick, and that's not him, that's surgery and stuff.
Yeah.
So, and
Yes,
his latest
with us,
book,
everybody, as we continue to explain this. If you can watch this on video, please do. Michael's got his books to show you so you can actually see them, and to visit his website along with us at msgodin.com. Michael, thank you so much for spending your time with us and caring so much about your patients. I have quite a question that might go down a rabbit hole for a minute. So let's talk about Kevin's hair. Do you do hair?
I do not do hair replacement, and this is my own hair. I have nothing done. Kind of got lucky in terms of got my mom's hair rather than my dad's hair, but I don't do that. But there are people who do it, and if you're going to do it, you kind of need to be set up for that, because there's a lot of equipment, technology. They take lots of grafts, sometimes 1,000 grafts, and then they split them in a microscope, and then they implant it. It's a very delicate and long and tedious process. So you really want to go to somebody who is set up for that and knows what they're doing with that.
Well, and just to prove to everybody, Doctor, I did have hair at one point. That's me, and I was in a play back then when I was 23. I had hair, and now I don't.
Kevin, did you stress it all out? Be honest.
I don't know. Now my this is kind of a funny story. My grandfather's name was Harry. He was bald from the time he was 24.
Cute. That's not very fitting, but I love how it's so contradicting.
and that's just all genetics, isn't it, Doctor?
I believe it is, yes. For the most part. I mean, there are some conditions that are caused by different things, but by and large, I think the genetics play a huge role in it, of course.
Yeah, and now I can tell people, well, I had chemotherapy, and that's why I don't have any hair.
Right. Don't do that. Please don't do that.
But Doctor, I'd love to dive a little deeper. I have two questions for you I'd love to cover. And the first one, I really want to dive a little bit deeper on the trust when it comes to people and the time that you spend with them when you are reconstructing what they look like.
Mm-hmm. Yeah, it's a tremendous responsibility. I mean, we can wear clothes, we can cover everything up, but our face is our face, and it's what we're identified by. It's how we're perceived. So it's a great responsibility. I would say that I take great care in trying to understand what the patient wants. I'll have the patient come in, and it happens now more than when I was younger, and they'll say, "Okay, tell me what I need," and I go, "That's not the way we're going to start. The way we're going to start is I want you to let me know when you look in the mirror every day what you would like to see improved. And I want to hear from them what's on their mind, because I may be seeing one thing, but that might not be top of mind for them." And so, it involves kind of a meeting of the minds and kind of sharing an aesthetic vision for what we can do for them. And I try to emphasize that, improvement is almost always attainable. Perfection is almost always not attainable. And that at the end of the day, it has to look natural. And so those are the kind of the cornerstones how everybody who's coming in put that.
Yeah, I think that's very important, building that relationship in the beginning, just just because that's what we're supposed to do. But how often is it that people come back to you? And is it because they want new surgeries done because they love the work you do, or is it because they're trying to upkeep with what you have done?
So one of the really satisfying things about being at this stage of my practice is I have been seeing a lot of patients for many years, decades, some of them, and it's very satisfying because I know their families, I know them. We talk about what's going on, with ourselves, and it's a very wonderful following them through life. I feel very honored when somebody lets me sort of shepherd or curate their beauty. And it's a great responsibility. And, I have quite a few people who have let me do that. And, I don't take it lightly.
Yeah, that's awesome.
And we need to get back to the book here in a second, but I got to ask you, how prevalent is, and I know you know this term, the term turkey neck. How prevalent is that? How difficult is that to help somebody have a non-turkey neck?
So I guess if you live long enough, you're going to have one. That's the bottom line, no matter who you are. And we never use that phrase, of course, but plenty of the patients do coming in. But that is an area that's just time, and when it gets to bother them enough, there are some really wonderful ways about fixing that. And
beautiful.
That's the lion's share of my practice now. Is I probably do more face and neck lifts now than pretty much anything else in my practice now.
And doctor, I just have to compliment you on your work as well, because I've seen some of the reviews and the people, and I think it's phenomenal how you keep people looking so natural without creating all these scars that make it look like there was something done, because I've seen that before. So I think that's very unique. I love that you use your artistry tools in that way.
Well, thank you for those kind words. It means a lot. Thank you.
You're very welcome.
I do have to ask you this, because this is, I just genuinely do not understand. Why does somebody want to have bigger lips?
Well, think of it as more shapely lifts. As we, age, things thin out, things fall, and that includes the lips. So you'll have somebody who maybe has had, what they perceive to be nice lips, and now they're getting a little bit older. They're seeing the kind of what they call the smoker's lines there, and they don't like that. And we can do some tasteful filler there to kind of help them. Or maybe somebody that has very small lips and would like to just have something a little bit more to put some lipstick on when they go out. So again, you don't want to see too big a change, but you can almost always help somebody. And the thing about lips is that when they're well done, you have no idea. When they're poorly done, you can see it across the room. So lips kind of get a bad rap because you got all these people overfilling just, with a huge amount of filler and it looks terrible. But when it's tastefully done, you have no idea that somebody did it. So I kind of say it's like the CIA. They get credit for their failures, but not for the things they prevent their successes. So I think lips are a little bit like the CIA.
Awesome.
Did you ever suggest somebody, why don't you just grow a mustache? And
not once, Kevin.
Horrible, Kevin. You don't want hair on my face.
Oh, well, it's not that bad, really. And I may have, lousy lips, but nobody knows.
That's
You're
true.
a very handsome man. I think you should stay with what you have.
That's exactly right. And by the way, we're talking with Dr. Michael
Godin. Everybody visit his website, which is msgodin.com. And also, let's turn a little bit of our attention towards your books. You have the new book, Fighting Gravity, that came out, that is a little bit based off of your story and a little bit of your curiosity side. Did you have to spark yourself back into that when you came back to writing this book after starting it so far in the future, or did it just flood back to you when you finished it?
Well, I wrote it really about 15 years ago. So it's just a matter of kind of going through the iterations of, I had all the basic story in there. And,
Gotcha.
I've tinkered with some scenes, just try to refine them a little bit. But, Fighting Gravity is, of course, a double entendre because as a plastic surgeon, we're constantly fighting gravity. And then, of course, he was fighting gravity in his own life, the sadness of, a relationship that didn't work out. And, so those are kind of was the thought behind the title there.
I love that.
Does anybody ever come into your office when you're fighting gravity and say, I'm just getting older and I don't want to be older anymore. So you need to, Doc, you need to fix me so I don't appear to be my age anymore.
People ask a lot of different ways. I always try to persuade them that what we want to do is we want to look really great for the age we are. So if you come in saying, I want to look 20, I want to be a Ken doll, I'm going to say, we're not going to do that, but we're going to make you the best version of the age you are. And most people are accepting of that.
And I know you got so many stories in the book, but out of pure curiosity, has anybody ever come to you and been open to talking about their health so that they know how to upkeep the work that you have now done? And do you guide them through how that works too?
Well, we when I meet a patient, we have their health history right there. They give me a summary of all the medications they're on, any past surgeries, any medical conditions. We go through all that because that is going to influence how well they would heal if we did anything, and what kind of they might have. So it's an important component for every patient, pretty much that we touch, to know the basic underlying health situation. So yeah, it's an important part of it.
Very good.
And I'm sure this happened to you or has happened to you many times, but in your dating life and in the book, Fighting Gravity, is there ever a date where it turns into from a date, nice to meet you, to, oh, you're a doctor, and then it turns into a consultation?
Oh, Kevin. Let's see. I can't think of anybody that, excuse me, I got a little cough today. I can't think of anybody that I was on a date with that then, people will ask, what would you do? And, my standard line is, you look great. I wouldn't change a thing. I mean, it just like comes out of my mouth immediately. So you really try to separate your personal life from your medical life. No, so it's pretty far apart.
Good.
That's good. And speaking of your medical, have you ever turned a permanent frown into an actual smile?
You can do things to help the frown, the corners of the mouth come up a little bit. You can use Botox, as a matter of fact. There's muscles that pull down the corner that we can relax a little bit to come up. There are some surgeries that kind of lift a little bit. You don't want to be the Joker, but you can kind of add things a little bit. Just have to have a very light hand about it.
Is there one surgery that people get done the most?
Yes, face and neck lift. And right now we're living in kind of the golden age of facelifting, I think. Excuse me, because there is an operation called the deep plane facelift. You may have heard about it. We're in a different level than we were years ago, and things are just moving. We're releasing some ligaments and things that held the tissues down, and in a very natural looking way, we can really move the deeper tissues without putting much tension on the skin, so the scars are nice and thin. And so I would say, that's a real advance. I think a lot of doctors are doing that operation now, doing it very well. So yeah, I'd say face and neck lift are my most common by far.
And I got to ask you, Dr. Michael, did you ever have a patient come to you after the surgery and start crying in front of you because they're so happy with the outcome?
There has been a little bit of that through the years, and it's very satisfying when that happens. Of course, it's humbling, but I get a lot of hugs, afterwards. Thanks, because we've got through this whole thing together. It's a process, the before, the during, and then all the aftercare as well. So yeah, there's definitely a friendship that is struck there, and I love seeing when they're happy, of course.
Thank you so much for asking that question, Kevin, because when we come back from this break, I'd love to ask you, doctor, about the first moment or patient that you had that was pivotal for you because you realized that the work you were doing was actually so important and powerful for others, not just yourself. So everybody follow along with us. He's got everything on his website, msgodin.com, his homepage, Meet Michael, to learn all about him. The books are available there and some short stories and blogs he's also made available. And if you're feeling inclined to contact him for any reason, he's got that option there as well.
And we need to take a station break, and then we are going to preview a brand new book promo that we have just created for someone. And, there may be one of those in your future there, Doctor, but or maybe not, but we'll see. But we need to take this quick break, and we'll be right back right after this with, again, Brichelle, our guest is Dr. Michael
Godin. Don't go anywhere, anybody. We'll be right back.
I love the way you say that. You're listening to Positive Talk Radio Network. We're on a mission to entertain, enlighten, empower, and educate through inspiring music, dynamic conversations, and yes, laughter. Join me, Kevin McDonald, and Brichelle as we declare our freedom from hate, division, and fear and celebrate a better way of living. Go to positivetalkradio.net to find out more. It is inevitable that death is part of life. But what if it was death that taught you how to truly live? That's what happened to Elizabeth DeCivo. When her mother passed away suddenly, everything changed. Her priorities shifted. What once felt urgent faded, and what truly mattered became clear. She discovered something powerful. Often the things we think matter don't. What truly matters are the moments. Life is a series of moments, and we get to choose how we live them. She now spells them moments, with M-O-M capitalized in honor of her mom. Choose Your Moments is not just a book about grief. It's about embracing life. It's about intention, choice, and the willingness to live fully. Because in the end, the quality of our lives is determined by the quality of our moments. And welcome to Positive Talk. My name is Kevin, and sometimes, Dr. Michael, I just make myself giggle because I was watching that and I was thinking to myself, sometimes the moments in life that we need make us that we need a plastic surgeon. So Brichelle, you had a question or two.
Yes, well, that's perfect because I'm so curious, Michael, to hear one of the moments that you had that was pivotal in your work where you were able to do some reconstruction for somebody and help them feel better in their own skin.
Well, there have been a lot, because when somebody has either an injury or they have, say a cancer and they lose part of their face, they feel in a way their life is over in a way that they will not be able to be out there in the world, that they're going to be a monster, that people will be repulsed by them. So if you can then take that person and reconstruct them in a way that, just makes them look like they would like to look, like they would like to present themselves, it's very satisfying. I've had people lose a good part of their nose from cancer, lips, ears, things like that. And then you have to, use all your creativity to try to reconstruct that. Sometimes in several operations, it's not always just one operation, and stage it. And at the end of the day, if you get a really satisfying result, they're happy and you're happy, and it makes you feel good about what you do.
So I have to ask you, because how do we keep the elasticity in our skin a little bit more as we're young so that we don't have to come and see you so often?
Well, I think first off, probably don't smoke. Okay. Second, invest in some good sunscreen and use it frequently. That's really important. So those are preventative things. Good skincare, just using good products, maybe getting a facial every once in a while, letting them grind the the kind of the dead skin cells off and infuse some good antioxidants and some good moisturizers. That's good. Kind of keeping up with that. Just not doing things that stress your skin. There's a certain amount of heredity that's involved. If your folks have good skin, you're probably going to inherit that. If it's challenging, then you just have to deal with that challenge. But there are things that you can do with your lifestyle for sure, like the ones I named, to make it better.
And Dr. Michael, I hate to maybe be the bearer of bad tidings, but you mentioned smoking. Is vaping as bad as smoking?
Well, the vaping is newer, and so I don't think if we know all the implications of it. But
It's worse.
the vaping permits a very high level of nicotine, if that's what they're vaping for. And nicotine is a potent vasoconstrictor, meaning that it will make blood vessels scrunch down, so you have less oxygen delivery to the tissues, including the facial skin. So it sure as heck can't be good for it. It's probably bad for it.
Makes sense. Yeah. What about, is there any treatments that you are like purely against that you will tell your patients not to do?
I don't know. I think if you go to good people and they are thoughtful about what they do, they're probably going to be okay. There's very rarely have to prohibit somebody from doing something. There used to be some permanent fillers, silicone, and things like that, and thank goodness nobody's using those anymore. That was a disaster. The face would change, the filler wouldn't change, it would pool, and you had to cut it out. It was just bad. So I think the important thing is to find somebody who's good. You want to see before and after pictures. You want to have a comfort level with that person. And if it makes sense to you after that, then you're probably okay doing it.
Good.
And I got to ask you because there's a injection that they do now with I had it. I had it, doctor, right there on the tip of my tongue.
I'm sorry, Kevin, don't take it.
It's Botox. That's what it is. That's because and I've heard commercials on Botox. Botox is going to make you just perfect. It's going to make you happy in every way, and the side effects are up to and including like death. So you have to be very careful with that, don't you? And go to somebody who really knows what they're doing.
Yeah, Botox has been the most popular cosmetic treatment in America for over 20 years now. Used properly, it's very safe, and has a nice effect. We do a tremendous amount of it in the office, and our patients love it. You want to go to a good person. You want to make sure you're getting real Botox. There is counterfeit Botox that people buy at a great discount from foreign countries. That's probably not a good idea. And then there are Botox alternatives, and some of them are good. But properly used, the Botox does very well. You might say, okay, it's a toxin, but I would say any medication you take in the wrong dose, including aspirin, right? So if you're taking it in the proper, I think that the Botox, when given by somebody who knows, can do very well.
How often do you work on men? Is that pretty common as well as women?
Men are an important part of our practice. The majority is women. We do facelifts for men. We do Botox for men. And some filler for men. So we have them come in, a lot of eyelids, a lot of brows. So I would say the lion's share is still female patients, but we have a bunch of men in our practice. I think they are by and large very pleased with what we do.
Awesome.
Well, I do have to say that the probably the biggest surgery for men isn't in your practice because you're the neck up, and this would be kind of below the neck, if you know what I mean.
Yes, let's stick with the head and neck there. Let's stick with that.
Oh, very good. I got to ask you, in your book, Fighting Gravity, was there a passage in there or a story in there that made you giggle or laugh out loud because of the story that you were telling?
Oh gosh, just some that I described, and I made up a good bit of stuff, but just putting my hero Nick Jordan in these just terrible situations, and just trying to have him, see the humor in there and be compassionate to whoever was inflicting a horrible date on him was kind of fun. So I think those were the ones that made me giggle a little bit, and I got to use some creative license there.
That sounds fun.
Because I just can't imagine the first time you're dating a new woman and she's got 4 kids, and those 4 kids have got 12 grandkids, and now it's time for you to go meet everybody at Thanksgiving. That's got to scare the hell out of me. Does it scare your character?
You know what? He didn't have that exact situation, but I think that probably would have made him kind of nervous. Hopefully he would have been enough committed and involved with the woman that he would have gotten over that and done it, and and done it well. But no personal experience with that particular situation, but I would imagine it would arouse some anxiety for sure.
I just wouldn't go if it was me.
Avoidant.
Yes. Well, they've got baggage. They've got kids that have got baggage. They've got grandkids that have got baggage. And then you have to, I would make everybody wear a name tag so that I have an idea who the hell I'm talking to at any given moment in time, which probably wouldn't go over real big. So I think me staying home would just be better. Don't you think? Having a TV dinner of like turkey and mashed potatoes and stuff. And that would be my deal. Cause yeah, but Dr. Michael,
that's such a good thought, though, because in your book, Michael, did you tell the kind of the perspective of the story of your character having to rediscover who he was?
Oh yeah, there was some reinvention, some dealing with some negative feelings from the divorce for sure, and he was also having some problems from at work. An employee who was sabotaging him, and he didn't know who that was, and he kind of had to figure that out. And he was used to being successful, and things weren't going well, and he had to handle some adversity in that. And again, he was fighting gravity, of course. So, but our boy Nick came out on the good side.
Good.
So that book has been out for how long now?
It came out mid-January, so I guess we're looking at about 2 months. Yeah.
Have you gotten any feedback from Amazon or anybody else yet? Because normally that takes a while.
We ran a promotion. It went to #1 in 3 categories. I think contemporary medical fiction, like second time around romance, and something else. So it's done really well. The reviews are good. And I think that's important. Maybe don't realize for authors that if you read a book and you review it, and it's very important to the author, because that's how other people then decide that they want to read the book as well.
That is really important, and we need to take our last break here real quick. And by the way, and I just want to tell everybody this, that if you ever want to meet Burchell live in person, you need to go to this event, and perhaps
there's actually a few coming up, but this one is real nice.
And we'll be right back.
If you're a woman running a business and feeling stretched, overwhelmed, or stuck in reaction mode, this isn't a you problem, it's a CEO shift problem. The Women's Success Summit is where women entrepreneurs stop working in their business and start leading it like the CEO. You'll leave with clarity, strategy, and an action plan that you can actually use right now. If you're serious about your business and your growth, this room is for you. Don't miss the Women's Success Summit, April 13th. Connect with a community of powerful women and gain real strategies to grow your business. Seats are limited. Register at p2q.link/summit26.
And welcome back to Positive Talk. My name is Kevin. Burchell is right there, and she is going to be at that summit, and I'm going to be the token white guy that gets to go along with her and stuff. So, Dr. Michael and Burchell, his website, please.
Yes. Go to his website, everybody, msgodin.com. And as you were talking about all the feedback from his book, please visit the website, click on the books, and you can see all of the amazing things people have gotten to review from reading this book and how they viewed it. And I want to kind of turn a little bit the big prick too. What is the basis behind that, and why did you decide to have that come out first?
Okay, so this is Fighting Gravity is long, about twice as big as The Big Prick. So I wrote The Big Prick as a prequel after Fighting Gravity, so that I could learn a little bit about the book business and maybe create a foundation for my character, Nick Jordan, who I want to continue to bring forth in a series. So The Big Prick refers actually to getting stuck with an HIV positive needle at the beginning of the AIDS epidemic. What this book follows a group of surgical interns in San Diego as they're learning to do surgery for the very first time. And it's in the mid-'80s. It was right at the beginning of the HIV epidemic. It was a very dark time in medicine. We did not have the means to save very many people. And a lot of people died, and we couldn't do very much about it. And we were working very hard. This was before they passed a lot of the laws that they now have, like the 80-hour work week, and that you can't keep people for 36 hours on a shift in the hospital. They used to be able to do all that to you. So we were exhausted. We were working all night. You can imagine, in my case, fixing facial trauma, broken bones, sharp bone fragments, right? Drills, screws, wires, okay? And my hands are just bathed in people's blood. And you're getting cut left and right. So we all, knew that there was a chance that we could get stuck, that we could convert, that we could die. And that was just part of the game. And anybody who was doing surgery at that time, learning surgery, went through that. So The Big Prick was, there's, again, all my titles are double entendres. So there's like a really jerky, senior resume in this. It was also The Big Prick. But Big Prick was actually being stuck with an HIV positive needle. And it sounds like a very heavy book, but actually there is humor in it. There is romance in it. The main character learns to surf for the first time and goes through, kind of gets bullied by the guys at the local surf spot, and then ends up repairing one's face, and then all of a sudden he's doc and they're treating him well. And so there's a lot of stories in there, a lot of humor. I guess all my books have some serious parts, a lot of medical parts, and then some humor and some romance. And that one certainly did.
It's awesome.
And just so everybody knows, in 1980, 81, 82, and Doctor can confirm this, there was a new disease out there. They didn't even know what it was. And people were starting to die. And they were going to the hospital and they would catch pneumonia. And I had a good friend of mine and they had no idea what it was. And it was a very scary time at that moment in time, because people were just expiring, and it was a really tough time. And you were practicing at that time. That must have been really a scary moment in time, because you didn't know if it was airborne. You didn't know, we didn't have a lot of information about it at that time, did we?
In the very beginning, we knew very little. I remember sitting in medical school in New Orleans, Tulane, in a lecture hall, and we were having an infectious disease lecture. And I said, I'm just going to tell you straight out, there's a new disease. It seems to be concentrated in San Francisco, and people are dying. And it's a combined immune deficiency disease, and we really are trying to figure it out. They didn't know how it was transmitted. They figured all that out pretty quickly. By the time this book is written, they knew what it was. They knew how it was transmitted, but at the same time, they didn't have a cure yet. And so that was the tragic thing, was that at that point, we could help people's symptoms. We could help with some of the infections, but very often we couldn't save them. And that was, awful. It was one of the worst things I've ever lived through by far.
Exactly. And I would love to be able to say that we have conquered AIDS around the world, but we haven't. There is medication for it. And in some cases, the United States were providing that medication. And then a lot of that program is stopped. And we have a gentleman who regularly comes on the show that I want to introduce to you, Dr. Michael. His name is Samuel. Rochelle, say hello.
Samuel Nyandika is here to say hello. Hello, my good people, Brother Kevin McDonald, my sister, Ambassador Rochelle, and guest brother Michael Godin. Receive warmest greetings from Kibera Restoring Hope Center, based in the slums of Nairobi, Kenya. We are watching this favorite program, Positive Talk Show. Thanks for highlighting our weekly feeding program. No child goes to bed hungry to the world. You are very welcome. We love you so much. And I'm so sorry about the connection last week. So everybody stay tuned with me and Samuel, because tomorrow morning we'll be live on Facebook feeding all the kiddos. So thank you for coming in and doing that. And I'm thinking so much still about trust, doctor, because let alone with your patients, don't you have to have a good relationship with the other doctors you're working with?
Well, yes, and fundamentally for me, that's my anesthesiologist, because I am up there doing the work. They're the one that is watching all the, the parameters, the blood pressure, the oxygen saturation, the heart, and they're making sure that while I am up there concentrating on sewing and moving things and making a beautiful result, they're keeping that patient alive and breathing and all the good things. So that is a super important medical relationship. I also have young doctors in my practice. I train a fellow every year. I'm now currently training my 21st fellow, which is a real honor. There's only about 60 of us in the US and Canada that get to do that in facial plastic surgery. And these young doctors come into the practice, they help me, they observe. I don't let them do the critical parts of the surgery yet, but they see it, and they're right there with me. And then they go off and they have their own practice, and they're all doing well. It's like my second set of kids. So those are some doctors who I also trust very much and have great affection for. That's
awesome.
And I imagine that you have to trust and believe in your anesthesiologist as well. And because I had my wrist fixed not too long ago, and they put a plate in it so that I could, move it again. And right before the surgery, the anesthesiologist came in, and he asked me a bunch of questions. And I said, I have a question for you. And he said, yeah, what is it? And I said, when do you get out of high school? Because he looks so damn young. I just
yeah, it can be scary.
Yes.
So, and they actually did something unique in that they deadened my whole arm because they were going to do and Rochelle, it was most oddest experience. You know how you could move your fingers and all that kind of stuff. It was like it was paralyzed, and I didn't feel it. I couldn't move it. I couldn't feel it. So now I know what it's like to be paralyzed, and I have a new respect for people that are having to live that on a daily basis, because I can't believe how difficult it is. Is that a new way of doing it, Dr. Michael? Or did you know?
I think they've been doing that for quite some time. It's a little out of my area, but they need to block things to enable them, obviously, to work on those delicate tissues. So.
Yeah,
I have to ask you, just out of curiosity, Kevin, you brought up nerves. And when you're working in the face, there's a lot of nerves. Do you ever warn somebody with certain things they want done that maybe the way that they can control and move and feel their face might change?
Well, that's an interesting question. And you mentioned feeling and moving. And those are the two different kinds of nerves, or sensory nerves and motor nerves. Sensory nerves, there's almost always some temporary numbness somewhere because you're lifting everything up. You're interrupting thousands of nerve endings, right? You're putting it back down, and then that over time that comes back. Now, motor nerves, the functioning nerves, that's a different case. In that case, we had to be very careful to avoid those nerves, and that's one thing that when we're doing facial plastic surgery, we're very mindful of, is keeping those nerves. Excuse me.
Good.
Dr. Michael, have you ever worked on a boxer?
Yes. I've worked on boxers and MMA fighters and rugby players. Yeah, there's a lot of facial trauma that happens in all those things. Yes.
Yes, I broke my cheek in a boxing match.
Oh,
and
wow, yes.
and
Yep.
the cheek separated, and the whole, like Rochelle, if there's the eye socket where your eye sits in, the
Mm.
whole thing was broken and crashed down, and so I was numb for the entire side of my face for like 6 months,
Right.
and
Good.
but that but that's quite the surgery to do as well.
Well, we see a lot of that. It's a common injury. It's often called a tripod fracture because there's an arch here, there's the infraorbital rim here, and then there's bone in the back. And often all three of those are broken, and then it rotates or it moves, and you've got to kind of get it back in position, and you've got to fix it somehow. And very often, screws and plates.
So you do work with reconstructing people's skull as well, not just the skin.
Their skulls, yes, that's part of facial plastic surgery. Is yes, actually fixing the bone, whether it's broken jaw or a broken cheekbone, like you were talking about. That's part of facial plastic surgery.
That sounds fascinating.
It does, and we've got another comment from the Kabir from the Restoring Hope Center, and Rochelle, go ahead.
Hi, everybody at the Kibera Restoring Hope Center. I love you. They say, greetings, team. We are listening and watching live from the slums of Nairobi, Kenya. You, Kevin, Ambassador Burchell, and Dr. Michael. Positive Talk Radio Show is our favorite program. God bless you all. Together we are strong, and together we are one. And I can't wait to be one with you guys in the morning. So thank you for that opportunity. Love you guys.
There are a bunch of folks in a room watching the show, and it's like midnight or 1 o'clock in Kenya.
Wow.
So
Oh, and before we finish this thought has to come out. Michael, have you ever had someone came to you and said, Doctor, actually, after coming and seeing all my options and what I wanted to do, I think I want to leave my face and my neck alone?
Sure.
Does that ever happen?
They usually don't come to me to tell me that.
Yeah.
They'll leave it alone. They'll just kind of not. I very often have to tell them that they're not ready for it yet. I have young people come in with very, very beginning looseness, almost nothing, and they'll say, "I want to get on." And say, like, this is not the time. You have to wait. And, I appreciate it when you're honest with them. When you for no selfish reason, you just tell them this. We're going to do this, or there will be a better time for this. It has to be the right time. Because in what I do, you don't want to do it a lot of times. You want to do it infrequently, and you want to do the right thing. So really, it's all about the right operation at the right time for that patient that's in front of you.
Very good.
I imagine, doctor, that it's like a jigsaw puzzle. Putting it all back together to determine how you're going to make each piece work and be in conjunction with all the other pieces. Is that kind of what it's like when you're reconstructing someone? And it's a very personal thing when you're reconstructing somebody's face from either a traffic accident or cancer or something, and being able to put that all together. Is that kind of how you think about it? Is it's a giant jigsaw puzzle and you're putting it all together?
Well, if everything is there and it's just not in the right place, then yes, you can think of it that way. Unfortunately, especially with trauma and cancer, a lot of times things are missing. So now you have a jigsaw puzzle where a third or a quarter of the puzzle is missing. And how are you going to make that still be a functional face, still be a presentable face? So then you have to think about, okay, can I make some incisions and slide some things forward or down or whatever to kind of take part of that. So sometimes it's if there's no tissue loss, just putting the pieces back together, sometimes obvious, sometimes not. But if there is tissue loss, then that can be a little bit more challenging in terms of the reconstruction.
And we, before the show and last time we talked about my son, who at one point in time is going to have reconstructive nose surgery. And it will be a really big deal because they're going to have to virtually take off the entire nose. Is that even possible with today's technology?
I think so. I think that surgery has come a long way. And that, depending, and I have no idea, but depending on the exact reconstruction that's required, there now are more options than there used to be. There are people that do nothing but, and I don't really do this, but I have colleagues who do this, nothing but microsurgical flap surgery. Well, where they'll take some thin tissue from another part of the body, hook it into the vessels, hook it into the nerves, hook it into the face, and really can make a nice reconstruction there. So, I'm sure he's going to good people. I'd be happy, after the show, if you want, just shoot me an email. We can kind of talk about where he's going, and I can suggest some people if you want. If he's in good hands, I would say in almost all cases, there's opportunity to get well.
And by the way, ladies and gentlemen, we've been talking with Michael
Godin, everybody. Michael Godin. He is one of the best doctors I think we've had on the show by far yet in my 2 years with Kevin. So thank you so much for spending this time with us. Kevin, thank you for making this possible. And everybody, if you are curious about either getting in touch with his book, the first one he's got that just came out 2 months ago, we've got Fighting Gravity. And don't forget to check out the other one, The Big Prick, which has got quite the storyline as well. But go to his website, msgodin.com. He's got all of the information there and a way to also contact him. Michael, before we end the show, is there any other ways people can reach you and a message you'd like to leave us with?
Well, excuse me. I'd say if people are interested in the writing, you can just look up the name of the book or the website you've been getting out. If they're more interested in the medical side, I just have a very simple website. It's just drgodin.com, just drgo.com, and that's where all the medical information, lots of before and afters, and you can find that there as well. And my last message would be, I love the concept here. I love the positivity of it. I think you all do a very great job. I think you make it get really comfortable. So thank you for having me. I've enjoyed the second time as much as the first time, and it's a pleasure and a privilege to be here.
Thank you so much.
Thank you so much for being here, and I hope to not have turkey neck anytime soon, but it's it's one of those things. Everybody, have a great day, and Rochelle and I will be back in about 23 minutes with a Kevin and Rochelle show, and so stay with us to enjoy that as well. So, Dr. Michael, thank you so much for being here.
Thank you, sir.
Thanks, Doctor.
Right.
See you soon.
Thank you, Rochelle. Thank you very much.
Thank you for being part of Positive Talk with Kevin McDonald, where stories inspire and voices remind us of what truly matters. May today's conversation give you hope, courage, and a reason to keep moving forward. And just remember, till next time, be kind to one another because each other's all we've got.